Physicians of Sri Lanka, Dr. Vindhya Kumarapeli, representing the past presidents, Dr. Hemantha Herat, representing the fellows, Dr. Susi Pereira, Professor Raj Wickramasinghe, representing the family of Dr. F.A. Wickramasinghe, representing the Ministry of Health, Dr. S.M. Arnold, Director of the Family Health Bureau, Dr. Chandima Silitunga, family member of the orator, Dr. Indika Kandagiri, representing UNICEF, Dr. Damika Roel, Secretary of the College of Community Physicians of Sri Lanka, Dr. Juan Ferdinando, and Treasurer of the College, Dr. Tushani Dabrera. Ladies and gentlemen, please be seated. To preside at the head table, I would like to call upon the following dignitaries. President of the College of Community Physicians of Sri Lanka, Dr. Kapila Jayaratna, our orator, Dr. Chirantika Vitana, Dr. Juan Ferdinando, Secretary of the College of Community Physicians of Sri Lanka, and the Treasurer of the College, Dr. Tushani Dabrera.
Past presidents, fellows, members of the council, members of the College of Community Physicians of Sri Lanka, members of Dr. F.A. Wickramasinghe family, distinguished invitees, respected colleagues, ladies and gentlemen. Good evening, Excellence, leadership, and service in public health. Session is not only a tribute to a pioneering figure in our field, but also a platform to spotlight the contributions of individuals who have made profound difference in the health and well-being of our communities. In keeping with this year's theme, ensuring everybody thrives, every community nourishes, the college has of innovative initiatives that span community health, community outreach, academic excellence, and policy advocacy. From media engagements that translate public health knowledge into accessible messages, to impactful policy dialogue, and creative platforms like storytelling nights and children's art competitions, we have worked out to bring public health closure to the people. We also proudly host international conferences and vibrant health festivals, reinforcing our role as both thought leaders and community partners. Today's oration builds on this momentum, timely, inspiring, and deeply rooted in the core values we uphold as community physicians. On behalf of the college, council and membership, I extend a heartfelt welcome to all of you gathered today. Our past presidents, fellows, members, invited guests, and colleagues for gracing this important event with your presence. A special note of gratitude goes to the beloved family members of the late Dr. F.A. Wickramasinghe, who are with us this evening. Your continued presence and support are a testament to his enduring legacy and the values he upheld. We are truly honored to have you here, and we thank you deeply for allowing us to keep his memory alive through this annual oration. Thank you very much.
Thank you. Ladies and gentlemen, we have now reached the highlight of the evening. I would like to cordially invite Dr. Kapila Jayaratne to read the citation of our orator, Dr. Chirantika Vitana.
It is both a privilege and a pleasure to introduce a remarkable public health leader whose work has shaped the landscape of adolescence and youth health in our country. It is with immense respect that I now read the citation of Dr. Chirantika Vitana, one of my colleagues and friends, this year's F.A. Wickramasinghe oration. Dr. Chirantika Vitana is a renowned public health professional and researcher, widely recognized for her contributions to adolescent and youth health as the National Program Manager of Adolescent and Youth Health, Family Health Bureau, Ministry of Health. A highly regarded scholar, she has demonstrated an unwavering commitment to preventive health care and medical education, shaping policies and programs that directly impact young people's well-being in Sri Lanka. Dr. Vitana completed her primary education at President's College, Homagama, and her secondary education at Visakha Vidyalaya, Colombo. She graduated from the Faculty of Medicine, University of Colombo, earning an MBBS, MSc, and MD in Community Medicine. With advanced cancer prevention, surveillance, and adolescent health training from esteemed institutions, her expertise spans public health leadership, medical research, and academic instruction. She has actively participated in numerous national and international conferences, presenting research findings and engaging in scholarly discourse. She has significantly contributed to policy formulation, strategic planning, and program implementation to ensure that adolescent health is prioritized within the national health system. She has led the development of national policies, strategic frameworks, and fostered implementation plans while providing policy guidance. Dr. Vitana played a crucial role in shaping adolescent responsive health systems, ensuring equitable access to youth-friendly healthcare services. Her work includes developing technical guidelines, training curricula, and modules on adolescent sexual and reproductive health while advocating for these services through policy dialogue with key stakeholders. She has also overseen national coordination and monitoring of adolescent-friendly health services, ensuring their accessibility, quality, and responsiveness. Before joining the Family Health Bureau, Dr. Vitana served as a consultant committee physician at the National Cancer Control Program, working extensively on cancer prevention and control. She has supervised several MSc and MD trainees, serves as an examiner for postgraduate examinations, and contributed to human resource development in adolescent and youth health. Dr. Vitana's international training and research engagements reflect her dedication to professional growth. She was awarded a prestigious fellowship at the International Agency for Research on Cancer under the Union for International Cancer Control, UICC, and completed advanced training in cancer prevention at the National Cancer Institute. She has trained as a master trainer in breast and cervical cancer early detection in collaboration with WHO and National Cancer Control Program in Sri Lanka. Additionally, she received specialized training in palliative care, adolescent health, and reproductive health from prestigious institutions in India, Australia, and Sri Lanka, and was a visiting fellow at HRH, Human Resource for Health, Hub, University of New South Wales, Australia, researching non-communicable diseases and cancer. Her contributions to adolescent health are further enriched by her participation in master training course on adolescent health conducted by the Royal College of Pediatrics and Child Health, London, and the Sri Lanka College of Pediatricians in 2016, and a short course on global adolescent health by the University of Melbourne in 2015. Chirantika has been the primary resource person for several national level technical publications, including the Standards for Quality Health Services for Adolescent and Youth in Sri Lanka, the National Strategic Plan for Adolescent and Youth Health 2018 to 2025, and implementation plan, the Protocol for John Piercer, Adolescent and Youth Friendly Health Initiative Centers, and the Assessment Tool for Adolescent and Youth Friendly Health Services. These publications have set the foundation for sustainable adolescent and youth health services in Sri Lanka. She has also led the Global School-Based Student Health Survey, GSHS 2024, in Sri Lanka as the principal investigator, contributing to evidence-based policy development and public health research. Further, Dr. Vitana is known for her oratory skills, engaging presentations, and ability to communicate complex medical concepts clearly. Her leadership and dedication have transformed adolescent health services in Sri Lanka ensuring they are youth responsive, evidence-based and accessible. She is the eldest daughter of Mr. Vitana and Mrs. Vitana and has a younger sister. Dr. Vitana is married to Dr. Indika Handagiri and has one son, Udwin, who is presently an undergraduate student at the Medical Faculty, University of Colombo. It is with great honor that we welcome Dr. Chirantika Vitana to deliver the FA Wickramasinghe Oration. Thank you.
The President will now award the College of Community Physicians Orators Medal to Dr. Chirantika Vitana.
Thank you very much, President Sir, for your gracious introduction. Good evening, everyone. The President, past Presidents, Fellows, members of the Council of College of Community Physicians of Sri Lanka, Professor Rajitha Wickramasinghe, and other family members of Dr. F.A. Wickramasinghe, members of the College of Community Physicians, all dignitaries from the Ministry of Health, dear colleagues, friends, teachers, ladies and gentlemen. I thank the President and the Council of the College of Community Physicians Sri Lanka for providing me the privilege of delivering Dr. F.A. Wickramasinghe Memorial Oration 2025 with immense gratitude. I accept the honor of delivering Dr. F.A. Wickramasinghe Memorial Oration for 2025 with the gratitude. This oration serves not only as a tribute but also as a celebration of the life and remarkable contribution of Dr. Felix Ananda Wickramasinghe, a true pioneer in public health in Sri Lanka. Dr. Felix Ananda Wickramasinghe was born on 22nd June 1923. He had his early education at Royal College Colombo and graduated MBBS Ceylon in October 1948. After completing his internship, he worked in the Department of Health Services in various capacities till 1953. In 1952, he was among the first to opt for a career in public health in the Department of Health Service. In 1953, he proceeded to the UK to read the postgraduate diploma in public health at London School of Hygiene and Tropical Medicine. After successfully completing DPH, he returned to Sri Lanka in 1954. He was appointed MOH Panadura and later joined anti-malaria campaign in 1958. He was appointed the superintendent of the anti-malaria campaign in 1963. In December 1971, he was appointed Deputy Director of Public Health Services. In September 1972, he was appointed Director of Health Services, a position he held till December 1974. Dr. Wickramasinghe's international career commenced while he worked in Sri Lanka as a consultant to many reviews of malaria control program in the region. He was a consultant to WHO, ADB, TropMed, World Bank, USAID. From 1975 to December 1983, he was the regional advisor on malaria at the Southeast Asia Regional Office WHO, based in India, New Delhi. After retiring from WHO, Dr. Wickramasinghe served as project chief of USAID-funded malaria control project. In recognition of his contribution to public health, he was made a fellow of College of Community Physicians Sri Lanka in 1997. Dr. Wickramasinghe was a founding member of the College of Community Physicians in Sri Lanka. With due respect to Dr. Wickramasinghe, I would like to introduce the oration today. Ladies and gentlemen, oration is on Youth in Focus, Advancing Holistic Adolescent and Youth Health, Policy to Action, Sri Lankan Experience. The term adolescent was first emerged in 15th century. It is derived from Latin word adolescere, which means to grow up or grow into maturity. As per Robert F. Kennedy, the term youth doesn't merely define a period of life, but signified a state of mind, one characteristic by qualities such as imagination, courage, and spirit and adventure. According to the global classification, UN defined child as up to 18, adolescent 10 to 19, youth is considered as 15 to 24. Collectively, from 10 to 24 are called as young person. This distinct periods spanning adolescent and youth deserve focused attention. Even in literature, uniqueness of adolescent has long been acknowledged. In the Winter Tales, William Shakespeare notes, I would there were no age between 10 and 320. Oh, youth would sleep out the rest. For there is nothing in between but getting wrenched with child, wrong in ancestry, stealing and fighting. In historical masterpieces, The Nations in Arms in 1887 expressed youth as years between 18 to 24 are more suitable for military service. Body is vigorous enough to endure hardships and shoulders are yet unburdened by life. The heedlessness of youth, a quality born of freshness, is valuable trait in martial endure. Here are two fundamental reasons that adolescent being significantly different from small children and adults. One is brain development, other is hormonal changes. During puberty, body undergoes substantial hormonal shift that influence emotions and behavior. However, the adolescent brain, particularly prefrontal cortex, which governs decision-making, impulse control, and risk assessment, remain underdeveloped until mid-20s. As shown in the diagram, brain maturation begins from the back and concludes at front, with prefrontal cortex being the last area to mature. In contrast, other brain regions such as amygdala, limbic system, responsible for emotion and reward seeking, mature early. This imbalance explains why adolescents often act impulsively, seek thrill and pleasure, and may disregard the consequences. As described in Lancet publication, understanding this neurodevelopmental trajectory is essential to truly comprehending adolescent behavior. Same concept is elaborated here. In bioecological model offers a detailed description of the framework of understanding multiple environmental systems that influence adolescent development. Microsystem, inner circle after individual, immediate environment, adolescents, family, school and neighborhood. Mesosystem, interaction between microsystem components. Exosystem, indirect environments. Macrosystem, broader cultural, legal, socio-economic context, including values, customs, national policies. These interconnected systems play a critical role in shaping adolescent growth and behavior. Adolescent has a fundamental right to health, yet they carry disproportionate burden of global morbidity and mortality. Over 2,400 adolescents die daily, globally, mainly from preventive causes. Investment in adolescent health yield triple deviant, improving current well-being of the adolescent, enhancing future potential, benefiting next generation through intergenerational transfer of health, knowledge and social capital. Economic and societal returns are significant in investing on adolescent. Evidence shows that investing in adolescent health education protection contributes to national development, economic productivity and equity. The conceptual framework for adolescent emphasizes life cycle approach as well as social determinants of adolescent and youth health. To achieve sustainable development goals, particularly Goal 3 to ensure healthy lives, Goal 4 exclusive, equitable, quality education, investing in adolescent and youth health is essential. Adolescents are central to long-term national and global developmental outcomes. Second edition of WHO Global Accelerated Action for Health of Adolescent AHA framework outlines systematic approach to promoting adolescent well-being, safe, supportive environment, learning and competence, agency and resilience, health and nutrition, connectedness and contribution. This framework argues the unique nature of adolescent and long-term societal benefits in investing in this life stage, especially through evidence-based programming, youth engagement, inclusive national policies. According to the WHO global estimates, among boys 10 to 19 years, road traffic injuries were the leading cause. COVID-19, self-harm, drowning, interpersonal violence were among first 5 leading causes. Adolescent girls, self-harm was the leading cause of death and maternal conditions being the 5th in list. In 2021, COVID was within the first 5 leading causes of death in both girls and boys. These patterns highlight the sex-specific and regional-specific differences in policymaking and interventions. If we come to Sri Lankan statistics, adolescents 10 to 19 group make up approximately 3.9 million, 16% of the population. Youth also 15 to 24 group constitute 16%. Altogether, 10 to 24 group accounts for 1/4 of Sri Lankan population. Sri Lanka's national program on adolescent and youth health and school health are aligned with global directorates such as Global Strategy for Women's, Children's and Adolescent Health, AHA Framework and much more. WHO 2021 global health estimates show differing mortality pattern among Sri Lankan adolescent and youth by age 10 to 14, 15 to 19 and 20 to 24. Among 10 to 14, first 5 leading causes are COVID-19, congenital abnormality, drown in road traffic accident, leukemia, while among other group, it is self-harm, transport injuries, drown in, and congenital abnormalities and COVID. So different leading causes are there among higher age group, 20 to 24, similar but in different order, self-harm, road traffic accident, drowning, interpersonal violence and falls. 2022 Global School Health Survey conducted over 2,500 13 to 17-year adolescents showed that underweight prevalence as 21%, obesity as 3%, overweight 12.1%, significantly indicating the issue. Regarding mental health, Global School Health Survey findings were 22.4% felt lonely most of the time or always. Nearly 12% were worried that they couldn't even sleep. 18% felt depressed. 15.4% had suicidal ideation during past 12 months before the survey. Findings of National Nutrition and Micronutrient Survey conducted by MRI, 2 surveys, 2018 and 22, indicated rising trend of anemia prevalence among both males and females. However, iron deficiency has shown to decrease across all demographic groups. This paradox highlights the need for further investigation into the underlying cause of anemia beyond iron deficiency. Sri Lanka has a notable decline in teenage pregnancies over 2010 to 2024, supported by a series of legal and policy interventions in 2011 and 2015. Key legal frameworks and international conventions underscore Sri Lanka's commitment to adolescent rights. Some of them are Convention on Child Rights, Children's Charter, ZEDO, and Legal for Age for Consent and Marriage, Cyber Security Act, and Women's Empowerment Act. There are several policy documents directing adolescent and youth health, maternal and child health policy, youth health policy, school health policy, and much more. There are significant milestones in the development of adolescent health. Circulars, guidelines, 2018 second National Strategic Plan on Adolescent Health, 2019 costed implementation plan of the strategic plan, and from policy to action, strategic planning. The development of Sri Lankan second strategic plan on adolescent health, followed by the process laid in the AHA framework and international guidance. Main models of adolescent youth-friendly health service delivery in the country are hospital-based and MOS-based. In international context, peer-based models, intervention through organized settings, and intervention through community-based networks and organizations are there and being tried in the country. There are 45 hospital-based young peer centers and 360 young peer center clinics in MOH offices. Services are available as self-referral and referral from other sectors. Nationally developed protocols and quality standards, other guidance are there. A field health component of adolescent youth-friendly health service include domestic visits by public health midwife, where they identify needy adolescents and do the necessary intervention or referrals, community outreach for youth training centers, integration of adolescent health module to youth training curriculum, outreach at workplaces. Special focus is placed on nutrition, maternal, mental health, sexual and reproductive health. Comprehensive guidance on SRH service provision has been developed for healthcare providers. SRH package included worst case based scenarios to support life skill based decision making regarding SRH. These are used as part of community based activities by public health midwife and other health professionals in the field. Key milestones in sexual reproductive health for adolescents include 2011 circular on the role of healthcare providers promoting care of underage pregnant girls, and 2015 enhanced legal clarification on the role of healthcare provider in provision of SRH for minors, which were achieved through continuous advocacy, with law enforcement and judiciary officers. There are multiple digital platforms starting from Young PSF website, Healthy School Life website, eBridge carrying SRH module, FB page, YouTube channels and all other social media platforms on youth health. When it comes to the school health program, it is conducted as joint program between Ministry of Health and Ministry of Education, SMI, immunization, health promotion, weekly iron folic acid supplementation, school dental service, in addition to school curriculum, school meal program and all other interventions are there. These are some psychosocial interventions carried out for school children. It is further elaborated here. Minimal care package for institutionalized adolescents promote equitable, non-discriminatory health services for institutionalized adolescents. Package outlines clear roles of MOH teams, coordination with probation authorities and other stakeholders. To optimize the service delivery, various models have been piloted throughout the world. One of that is district model. Key challenge remains. Many adolescents don't pursue their need for support. There is limited trust in healthcare providers all over the world. One tested model is district model for adolescent and youth health, which was piloted successfully in India and other countries in the region. At Sri Lanka, North Central Province was selected for this pilot, and Health Promotion Foundation and University of Rajarata functioned as mentoring agency with the support of WHO. Key activities implemented were establishing district-level technical advisory committee, working groups, developing a district-wide implementation plan, training health and non-health personnel, engaging youth for planning into implementation and monitoring. This initiative resulted youth empowerment and strengthened the services and meaningfully engaged youth. This model is now being scaling up to the other districts after external review. These are the planning stage, youth empowerment by MOHs, reviewing of the process. Globally, meaningful adolescent and youth engagement is recognized as critical element accelerating adolescent health. Youth are now actively involved from planning to implementation and monitoring, with increasing visibility in topic-specific agendas. This participatory approach continued to show positive impact on adolescent health. Innovative strategies to enhance youth engagement included youth consultation for insight and planning at all levels, national, district and divisional level, formation of youth working groups, youth leader training as trainers, development of innovative youth-led projects. Pilot projects demonstrated strong acceptance and impact primarily through streamlined packages. Youth involvement in decision making, technical advisory committees, training of trainer programs for youth, national and district technical advisory committees, youth are represented, working groups and training of trainer programs are there. Peers share knowledge and develop skills in rest. Youth initiated project in Panadura at the COVID time enhanced the participation for vaccination through their initiatives. They supported other health aspects. Dedicated youth hub rooms have been established in selected hospitals where young PSS are functioning and some MOH areas. These spaces offer relaxation, indoor games, social interaction, productivity, enhancing activities. Importantly, parents are educated on this purpose and benefits of these hubs to foster greater trust and participation. A feedback mechanism is being implemented, review meetings, suggestion boxes, and social media feedback. So, after these youth engagement initiatives, youth voices and testimonies showed the transformation. Their own words, youth shared powerful testimonials. After joining Youth Hub, I started sleeping better. I used to spend all night on my phone, but now I wake up to birds on and start day with fresh air and gratitude. Our doctor feels like mother to us. She has filled the void for me. Youth Hub gave me sense of belonging. At first I was skeptical of youth group, but working as a team taught me to listen, value ideas and support each other. We have grown together. These were some testimonies from the young PSS centers functioning well with youth hubs like Kalutara, Panadura. Achievements of meaningful engagement youth, immediate outputs were increased service access, positive service acceptance, wider implementation of adolescent youth-friendly health services, health staff's attitudinal change, and they initiated service provision, greater networking with the other stakeholders. However, challenges are there. Despite success, challenges remain. Mixed response from both staff and youth in some area. Low participation in certain locations. Urban migration of youth from area to areas. Staff turnover, continuous retraining need. Sustaining multi-sector engagement remained a concern. Other challenges of adolescent youth-friendly health service in the country as holistic approach, lack of prioritization at all sectors, limited psychosocial and community support, emerging concerns like e-cigarettes, cybersexual harassment, social media improper use, inconsistent adoption of adolescent-friendly models, gaps in meaningful engagement of youth in certain areas. So, as we go forward, we have to bridge these gaps. We must strengthen policies on nutrition, physical activity, substance use, cyber safety. And need is there to enhance staff training on adolescent responsive health service at all service delivery points as identified by WHO. Develop targeted outreach for marginalized groups. Prioritize adolescent health across centers. Adolescent responsive service provision. Provide inclusive services. Foster low-cost interventions. Expand research like surveys national level and testing interventions. Integrate meaningful youth engagement with our next strategic plan. So, this is the call for action. Let us unite in empowering adolescent and youth, safeguarding their right, building a world where no one is left behind. Investing in young people is investing in nation's future. Let us guide them toward a life of health, dignity, and purpose. So, I wish to express my heartfelt gratitude to Professor Rajeshwar Wickramasinghe and Dr. F.A. Wickramasinghe family, President, Secretary, Treasurer, Council members of CCPSA, Organizing Committee of the Oration, with special thanks to Dr. Nilupul, the Director and the staff of the Family Health Bureau and the Adolescent Health Unit staff, Director, Consultants and AV team of Health Promotion Bureau, President SLMA and the team, teachers, colleagues, friends. At last but not least, my family, my late father, mother, husband Indika, son Buddin, and my sister Harsha and the family. Thank you.
Thank you very much, Dr. Chantika Vitana, for that intriguing and enlightening oration and educating us on youth in focus, advancing holistic adolescent and youth health in Sri Lanka. To conclude our evening on a melodious note, we present two beautiful songs by Dr. Ayesha Gunasoma from the Adolescent and Youth Health Unit, Family Health Bureau, a solo originally by the legendary Nanda Malini, followed by a duet with Dr. Nilupul Janapriya, Registrar in Community Medicine, featuring a song originally sung by Deepika Pridarshini. So ladies and gentlemen, please sit back and enjoy the musical treat by our very talented colleagues.
පාටින් ඉස්කෝලෙට පුංචි මගේ අතීතයේ මං තනි වෙනවා. වතුරෙනි මැද දෙවතරගේ දොර පාරින් එගොඩ වෙලා මගේ හිතින් මං ආයෙත් පාසල් යනවා. අන්න බලන්න ඉදිකඩ ළඟ කුක්කුරේන රොකී ඇවිත් පුංචි උන් ඉඳිනකම් පාර බලන්නේ. ඉනින් සෙලින් ඉන්නුන්ට එකතු වෙන්නේ. එක පුටුවක වාඩි වෙලා එක පැන්සල දෙකට කඩන් අකුරු කෙරුව කාලය නෑ ආයෙත් වෙන්නේ. වන්න තුටුව නව ලෝකේ ඉරුළු පලන්නේ චින වෙලා පුංචි දොයි ඉඳීලුව ගොඩ වග කන්නේ. අන්න බලන් ඉදිකට රඟන් කොක්කුරෑන වගේ ඇවිත් පුංචි උන් එනකන් පාර බලන්නේ. ඊතරේ ගිහින් එකතු වෙන්නේ. අන්න බලන් ඉදිකට රඟන් කොක්කුරෑන වගේ ඇවිත් පුංචි උන් එනකන් පාර බලන්නේ. ඉන්සරි ඉන්නුන්ට එකතු වෙන්නේ. පුංචි උන් එනකම් පාර බලන්නේ. ඉන්සරි ඉන්නුන්ට එකතු වෙන්නේ.
A big thank you to Dr. Ayesha and Dr. Nilupul for sharing their beautiful voices with us tonight. And now we have come to the end of the evening. I would like to cordially invite Dr. Ruwan Ferdinando, Secretary of the College of Community Physicians of Sri Lanka, to deliver the vote of thanks.
Thank you. President Dr. Kapila Jayaratna, our orator today, Dr. Chirantika Vitana, Professor Rajita Wickramasinghe, and all family members of Dr. F.A. Wickramasinghe, past presidents, fellows, council members and members of the College of Community Physicians of Sri Lanka, all officials from the Ministry of Health and other ministries, officials from UN agencies and members from academia, chair and members of the Oration subcommittee of the CCPSA, distinguished guests, ladies and gentlemen. It's my distinct pleasure today to propose the vote of thanks here on behalf of the College of Community Physicians of Sri Lanka in this important event. First and foremost, let me congratulate our orator today, Dr. Chirantika Vitana, for delivering an inspiring and thought-provoking oration. Your dedication, preparation and scholarship have added immense value to this occasion, and we are truly grateful for your time and commitment. We extend our heartfelt appreciation to Professor Rajita Wickramasinghe and the family members of Dr. F.A. Wickramasinghe, in whose honor this oration is held. Your gracious presence here today, sir, and your continued support over the years to the college have been a source of strength and inspiration to us. This oration stands as a tribute to the enduring legacy of Dr. F.A. Wickramasinghe, and it is truly enriched by your presence. We also express our sincere thanks to the current president, president-elect, past presidents, fellows, council members, and all members of the College of Community Physicians of Sri Lanka. Your leadership and unwavering support and commitment continue to be the inspiration and the foundation upon which the college advances its mission. A special word of appreciation goes to the chair and members of the Oration subcommittee of the CCPSL. Your meticulous planning and the commitment behind the scenes have made this event a successful one. We are deeply grateful to the officials from the Ministry of Health for their unwavering support throughout. It is very vital to achieving our shared goals in public health. To our colleagues from other ministries, academia, and UN agencies, your continued support, partnership, and collaboration are invaluable, and we are truly appreciating your presence here today. Our gratitude extends to the director and staff of the Family Health Bureau, and also Director, Health Promotion Bureau, and the staff and the consultants for providing us the audiovisual team and the equipment, and also whose expertise behind the scenes have been instrumental in the conduct of this event. Special thanks goes to Dr. Dakshira Galapati, our company today, for her poised and professional moderation, which ensured the seamless flow of the event. We also wish to express our sincere appreciation to Mr. Lanka, our dedicated college assistant, for his consistent support and tireless efforts. A heartfelt thank you goes to the postgraduate trainees and trainees of community medicine, whose enthusiasm, dedication, and hard work have been truly commendable. And it's very inspiring for us to see a truly committed young generation coming up in the pipeline. Their capacity is evident in the crowd gathered today, and we are witnessing a very well organized FA Wickramasinghe Oration this year. To all our distinguished invitees, your presence today has added prestige and warmth to this event, and we are sincerely grateful. To all institutions and individuals not specifically mentioned here, but who have contributed to the success of this event, we are very thankful. Once again, thank you all, ladies and gentlemen, for your participation, and we look forward to continuing our collaboration for the betterment of public health and of our communities. I wish you a very pleasant evening. Thank you.
Thank you. Ladies and gentlemen, this brings us to the conclusion of the proceedings tonight. The Council of the College invites you to a fellowship reception held in the ground floor of this building. Now please rise. The ceremonial procession will leave the hall. Thank you, ladies and gentlemen. Wishing you all a very good night.